everybody. My name is Dr. Prakash Sanzgiri and I'm a cardiologist associated with LilavatiHospital since its inception. Today I'm just going to talk and discuss with you how to prevent coronary artery disease, what we commonly call as blockages in the circulation of your heart. Please understand that these blockages in the circulation of your heart can also be associated with blockages in the circulation to the brain, to the kidney and to the lower limbs. We as Indians have these blockages coming much earlier, and these blockages come earlier, maybe a decade or so before what happens in the Western world. Now this is very important to understand because prevention should start early. It is never too early to initiate the process of preventing these blockages. But why is it that Indians get these blockages? One of the reasons is there is something called the Asian phenotype obesity. We see a lot of people, young, old, with a big paunch. The fat which is deposited in the body can be deposited below the skin, or it can be deposited along the organs of the body. So that around the intestines, around the kidney, in the liver, and around the heart. That fat is the bad fat. It's called visceral fat. And visceral fat itself tends to promote formation of these blockages. So one of the best ways to prevent coronary disease, or for that matter any vascular atherosclerotic disease, is to prevent obesity. And how can you prevent obesity? By a good diet. When I say a good diet, the first thing is everyone loves to have junk food. Everyone likes to have sweets. Yes, sure. Definitely once in a way it's okay, but let the occasion not be too frequent. The daily diet should be Spartan, more of vegetables, more of fruits and more of roughage in the food, less of fatty foods, and try to avoid sugars, cold drinks which you get available, the sodas and all those canned and Tetra Pak fruit juices. These have a lot of sugar and sugar is bad for you. Even if you don't have diabetes, sugar is bad for you. So avoid these as much as possible. In addition to that, in the food items, if you can change from rice and wheat to millets, that is jowar, bajra, ragi, these have low glycemic index, sugar in that the carbohydrate is absorbed slowly, and therefore the chances of you becoming obese becomes much less. Additionally, to lose weight, exercise is a must. And believe me, you should exercise at least 4 to 5 times in a week. And that would be, even if it's 30 minutes, you don't need to go to the gym. You can go for a walk. Or the best thing, particularly for the younger people, take up a sport, badminton, table tennis or tennis, swimming. By doing that, not only are you exercising all the parts of your body, but you're also getting your mind off the day-to-day stress. And that's where you can lose weight. If those people who are obese, you must check out for diabetes. You must check out the sugar, HbA1c, because pre-diabetes is widely prevalent among the obese people. And pre-diabetes leads to diabetes, and diabetes is one of the most important risk factors. So those people who are obese, please check your sugars, your HbA1c regularly, at least yearly, and if abnormal, maybe more frequently. For those people who are diabetics, follow your doctor. See that you take your medicines regularly, see that you diet, see that you exercise and keep your lipids low so that you have preventive measures for preventing coronary artery disease. That leads us to the fact that blood lipids play an important part in preventing coronary artery disease, and keeping your LDL cholesterol low, 100 and less, and if you're diabetic, 70 and less, I'm talking about LDL, will definitely help to prevent the blockages. Similarly, exercise increases the HDL, which is a good cholesterol, and will also help to prevent blockages. Blood pressure is another measure which causes blockages, and you have to keep your blood pressure on the lower side. But one high blood pressure reading at a time of stress does not mean that you have high blood pressure. You require 3 readings persistently high to say you have high blood pressure. And once that is there, use measures initially, weight reduction, salt reduction, exercise. If it doesn't come on with that, appropriate medicines have to be initiated. Regular blood pressure checks have to be continued during the period of your treatment. After the COVID pandemic, I've been advising many people to see to it that they have a BP apparatus at home, particularly the elderly people, so you can monitor your blood pressure at home. home blood pressure measurement is a very important factor. Similarly, you should also see to it, if you have diabetes, monitoring the sugar at home by a glucometer is useful. Once you're covered with hypertension, tobacco is a very, very important risk factor. And there, smoking, either passive or active. That is, if you're in a room and your friend next to you is smoking, you become active smoker, or you can call it a passive smoker. Similarly, chewing tobacco or using the e-cigars or all these other things are equally bad. Then sleep. These days I hear about people sleeping very late at night, 2 o'clock, 3 o'clock. Please, nature has given us a circadian rhythm. What it says, the moment the light goes down, your brain says, okay, time to shut down. And by shutting down, your body metabolism is reduced. Your blood pressure is reduced. Your pulse rate is reduced. Now, at this moment of time, you start going on your chat box, or you go and sit on your laptop, or you see a movie. What happens is the blue rays from all these tend to change the melatonin secretion in the brain and disturb your sleep pattern. You need a minimum of 6 to 7 hours of continuous sleep to allow your body to heal. Less than that is harmful for your body, as bad as tobacco, as bad as diabetes. Please understand that in addition to that, if you are a snorer, you may have obstructive sleep apnea, which is equally bad for your body. Particularly in these obese people, obstructive sleep apnea is very dangerous. Now, people tell me, oh, I have stress at work. Yes, all of us do get stress at work, but it is never the stress which matters. It's your response to stress. If you react violently, if you get disturbed, then that is going to tell on your health and it's going to promote blockages. Keep on wondering, age is an important factor. But these days I have seen an acute myocardial infarction even in the people at the age of 25 and in elderly people at the age of 80. Yes, as you grow older, your arteries become harder, you have more blockages, and you have a higher tendency to develop coronary artery disease. Each of us keeps on saying, oh, I got this problem because my father got it. When you ask him, at what age did your father get it? Oh, he got it at the age of 70. That is not genetic predisposition. Genetic predisposition means that multiple members in your family have had a cardiac event below the age of 45, even much earlier, or in females, even before the menopause has set in. So that is genetic predisposition, and that can be because of a lot of factors. Let's not keep on saying that it's my family which has given me this heart disease. No, it's your lifestyle which has given you this heart disease. And finally, one thing which is always forgotten: pollution, adulteration and contamination. Pollution of the air, adulteration of food and contamination of water are important factors where chemicals are entering your body, and these factors can cause coronary artery disease. The objective of talking to you was to prevent, because once the disease sets in, it causes problems and it changes your life. It changes your future. It reduces the chances of you achieving the heights you want to achieve. So why not start the prevention as of today? Thank you, everybody.